Okay, so last time we left off at glomerular filtration rate. So again, this is the amount of filtrate that's being formed in all of the renal corpuscles of both kidneys per minute. You don't need to memorize this number. However, just be aware that that is what we're talking about. And it's really important that our glomerular filtration rate is fairly constant. If it's too high, meaning the pressure is too great, a lot of times useful substances are going to be lost because there's so much filtrate being formed that it's moving through the system too quickly for the nephron to be able to take back up or reabsorb important substances. Again, if it's too low, we may not get enough things being filtered out and removed from the body, which is bad. We don't want an accumulation of toxic substances or waste products because they may become toxic at higher levels. And so that's why we have our kidneys. And I don't know if you guys have ever watched I Love Lucy. If not, I know it's black and white. I know it's super old, but very funny. In this skit, if you have watched it, this is Lucy. This is her best pal Ethel. They are working in a chocolate factory, and their job was to basically hand wrap these individual little chocolates. And they started doing that, and they were doing such a good job that they then decided to increase the speed of the conveyor belt on them, and it became so fast they could not possibly keep up with it. And so what you're seeing here is they're trying to hide the evidence of them not being able to do their work. So they are trying to eat the chocolate, stuff it down their shirts, whatever they can do to get them off that conveyor belt. So again, if it's too high, useful substances may be lost because it's just going too fast for some of these transport proteins to be able to do their job. All right, so how do we then regulate our glomerular filtration rate? Well, there are three main ways. There's autoregulation, neural regulation, and then hormonal regulation. So again, let's just take a quick look at this diagram. Here's our afferent arteriole. You can see the flow of blood. Blood is coming in this way. This is the glomerulus. This is where fluids and substances will get filtered into this Bowman's or glomerular capsule. They will then be sent down toward the proximal convoluted tubule and the rest of the nephron. You'll see there's something called these mesangial cells. We'll talk about those in a little bit. They are different from the podocytes. The podocytes are these that you see here, these nuclei and these little kind of interdigitated pedicels here. These mesangial cells are in between those loops. And then after that, you have your efferent arteriole. And looking at this is that ascending limb of the loop of Henle. There's going to be these specialized cells here called the macula densa cells. There are also these specialized cells here in the afferent arteriole along the walls where, notice how they're touching. These are called the juxtaglomerular cells. Together, the macula densa and the juxtaglomerular cells are going to form something called the juxtaglomerular apparatus. More on that in a minute. And then in this diagram, you're also seeing nerve innervation here of the afferent arteriole. All right, so onto these individual mechanisms. So renal autoregulation is very simple. There are stretch receptors in the walls of the afferent arteriole, and as blood pressure increases, there'll be more force being put on those walls. They'll feel the stretch, and any of the smooth muscles in the walls of the afferent arteriole will then contract to try to maintain a consistent flow of blood and blood pressure going into this glomerulus. Now, they don't always stay tense. If they are not being stretched, they simply relax. Again, and that helps maintain a regular flow. I tend to think of this sort of like, I don't know, maybe, we've all seen videos of people in a big windstorm or something. If you're just standing outside and it's not particularly windy, you just kind of stand there and your muscles that are normally hold you upright. As that flow of air becomes greater and greater, you have to put more and more effort into standing upright, but you're trying to maintain an upright standing position, right? And then if the wind goes away, you would then relax those muscles. So that's kind of the same idea. So as more force is being exerted on the walls, they will try to contract. And then when that force goes away, they will relax. Again, trying to maintain a consistent flow into the glomerulus. In tubuloglomerular feedback, this is going to be our macula densa cells helping with the constriction and dilation of the afferent arteriole. So those macula densa cells here in the ascending limb of the loop of Henle, they are releasing nitric oxide, and nitric oxide causes vasodilation. So, but under normal conditions, they'll release a certain level of nitric oxide, maintaining a certain level of vasodilation. If there's flow that is going through too quickly, these will, and again, we're not picking up enough of the materials that we need to, the macula densa cells will detect that, and they will stop releasing nitric oxide. And so since nitric oxide causes vasodilation, by stopping its release, it will cause vasoconstriction, meaning that it will reduce the amount of flow going into the glomerulus, reducing the glomerular filtration rate, reducing the filtrate that's being created, which would mean that there's more time to pick up those solutes that we need. And so therefore, we would have a decrease in the osmolarity. And, so again, that's that feedback that the macula densa are constantly doing. Now, it's easiest for us to think of this in like these huge kind of teeter-totter kind of imbalances where it's either super high osmolarity or super low osmolarity. But just be aware that any of these sort of hormonal releases or anything like that, it's more minor adjustments. So they're not going to be these all or nothing kinds of things. So there's minor adjustments in the amounts of nitric oxide that's being released. Okay, hopefully that makes sense. Now, as far as neural regulation goes, sympathetic fibers are going to cause vasoconstriction. So you'll see at rest, the blood vessels are dilated because at rest, parasympathetic activity is what is predominant, and the renal autoregulation is what is working. So either this myogenic mechanism or this tubuloglomerular feedback from the macula densa cells, these two are what's working for you when you're under your rest and digest situation. Now, again, this is not an all or nothing thing with moderate sympathetic stimulation. The afferent and efferent arteriole is going to constrict. So think about the times where you might have a sudden increase in blood pressure, like if you're exercising or slightly nervous, things like that. So with that slight increase in blood pressure, again, you want to make sure you're protecting your kidneys. So you're going to slightly decrease your glomerular filtration rate. With extreme sympathetic stimulation, and I mean like some hardcore exercise, not just going for a brisk walk or anything, or hemorrhage. So let's, make sure when I maybe should have specified that, but like, exercise that is pretty stressful. So I don't know, like like you're playing a long game of soccer or something like that, some very vigorous exercise. Again, you're going to have a high sympathetic nervous system activation. That means that the vasoconstriction is going to be greater, and specifically it will be greater to the afferent arteriole. And by really closing down the blood vessel that's leading into the glomerulus, it's going to help lower the blood pressure, as well as lower the urine output, and allow the blood to flow to the tissues that need it. So your muscles, right? If you're trying to run away from zombies, that is not the time to be producing more urine, right? Your body needs that water for either sweat production so you don't overheat, or so you don't have muscle cramps, right? That blood flow needs to go to the muscles. And the last one is going to be a hormonal regulation. So our main hormones that are going to be working at this level of glomerular filtration are going to be atrial natriuretic peptide, and this is going to increase our glomerular filtration rate. Atrial natriuretic peptide is going to be released by the atrium of the heart, right? So stretching of the atrium, that would occur with the return of blood flow to the heart, which would indicate an increased blood volume, will cause the release of this atrial natriuretic peptide. And what it's going to do is it's going to help relax these mesangial cells. And by relaxing these cells, it helps increase the surface area of the capillary. So you can kind of think of these mesangial cells as kind of holding it together a little bit more. And by doing that, by relaxing these mesangial cells, it will increase our glomerular filtration rate. We'll see in the next lecture about fluids and ion and pH balance. Atrial natriuretic peptide also has some other functions as well. One of those is to make sure that you're actually reducing the amount of water that is in your body. We've already talked a little bit about this when we were in our earlier in the semester. We're talking about blood and blood vessels. And then angiotensin 2 will also, angiotensin 2 will reduce glomerular filtration rate. So whereas atrial natriuretic peptide increases glomerular filtration rate, angiotensin 2 does the exact opposite. It's going to reduce it. So it is a potent vasoconstrictor. So angio blood vessel tensin, vasoconstrictor. We've already learned that. It narrows both the afferent and efferent arterioles equally, and that's going to also reduce our glomerular filtration rate. It reduces the amount of blood flow into the glomerulus. Reduce that, you reduce the amount that can be filtered. Reduce blood flow, you're going to reduce the blood pressure, which reduces the amount that can be filtered, right? So again, angiotensin 2 is one of those mechanisms that's going to help you retain water, right? Okay, so just kind of going back, the way we regulate our glomerular filtration rate, we have autoregulation, and that one of those was our myogenic mechanism. The other was the macula densa cells releasing nitric oxide, the tubuloglomerular feedback mechanism. We had our sympathetic nervous system and our parasympathetic nervous system also regulating glomerular filtration rate. And then our two main hormones were atrial natriuretic peptide and then angiotensin 2. Right, atrial natriuretic peptide increasing our glomerular filtration rate, angiotensin 2 decreasing it. Okay, hopefully this makes sense to you. If you have any questions, please let me know.